Okay, Section 6. Big Pharma, Essential Medicines, and Pharmaceutical Companies. Let's talk about essential medicines. Essential medicines are defined by the World Health Organization as the medicines that satisfy the priority healthcare needs of the population. They are medications to which people should have access at all times in sufficient amounts. And so why do we have the essential medicine list? Well, there are three considerations. One is access, two is prices, and third is effectiveness. There are medications to which people should have access at all times in sufficient amounts, and the prices should generally be at a very affordable level. The list is important because it forms the basis of national drug policy in more than 155 countries, both in the developed and developing world. Many governments refer to WHO recommendations when making decisions on health spending. Countries are encouraged to prepare their own list, taking into consideration local priorities such as widespread diseases or drug overdose and such. It is estimated that access to essential medicine could save 10 million people a year. The WHO started publishing a model list in 1977 and is updated every so often. There is also a separate list of essential medicine for pediatric use, which are for child patients. This makes sense since children and adults have very different needs. The current essential medicine list for adult patients contain over 400 medicines as of 2019. Both the WHO adult and children's lists contain a notation indicating that a particular medicine is complementary. Thus, essentially, there are two lists, the core list and the complementary list. The core list presents a list of minimum medicines needed for a basic healthcare system, listed in the most efficacious, safe, and cost-effective medicine for priority conditions. Priority conditions are selected on the basis of current and estimated future public health relevance and potential for safe and cost-effective treatment. The complementary list presents essential medicines for which specialized diagnostics or monitoring facilities are needed. In case of doubt, medicines may also be listed as complementary on the basis of higher cost or less attractive cost effectiveness in a variety of settings. Now the next question might be, how do they decide what medicine goes on which essential list? Here are some of the considerations. First, you have to consider how common is the disease or condition that you're trying to treat. You want to consider how much evidence you have for this particular drug for the benefits that this drug offers. You want to see how bad the side effects are. You want to see the cost to benefit ratio. And lastly, if there are any alternatives, whether for cost, benefits, and side effects. For example, if you have two drugs, one costs $100 and another one costs $10, and the benefits are the same, you will want to pick the one that costs $10, right? Let's assume they are both $50 now, and one has more benefits than the other. Then you want to pick the one that has more benefits. Of course, in reality, it's not as simple as pick and choose, and that's why we have experts to balance between the benefits, the side effects, and the cost. And if there are any alternatives out there that are better in any of these three factors.